The first muscle is going to be hamstrings. So before applying the technique, what is the principle behind it? Generally, we do static stretches, dynamic stretches, and slow progressive, eccentric base strengthening to increase the mobility and to generate more power from the muscle. So here the principle is going to be two. The first thing is muscle energy technique, where we use isometric holds, which is contract relax and the hold relax. Here we are going to integrate two, where the muscle energy technique and the distraction, which is movement with mobilization, is going to come into play. Here we are going to integrate both these techniques to increase the length of the hamstrings. So where we can apply is tight hamstrings and adductors to increase the straight leg raise range. In case of chronic hamstring and adductor tendinopathies, acute and facet lower back pains, to reduce neural tensions. For all the joint pathologies, let it be piriformis where the pain refers down to the thighs. These are all the indications where we can apply, and contraindications can be, as we all know, acute surgical cases, let it be TKAs, THRs, acute spine surgeries, acute disc herniations, spinal instabilities where you should not increase more power immediately, osteoporosis, geriatrics, and the pregnancy. So these are all the contraindications for these techniques. The first technique is going to be the hamstring lengthening technique. As we all know how to check the basic hamstring length check. So it is basically 90-90 test, as we all know. So I chose it because yesterday we were just observing who has a lot of tightness. So he had more tightness. So this is his current hamstring length. When we come to the edge. Yes. So where he is going to, we are going to give passive distractions where he is going to perform active isometric movements, which is knee flexion followed by hip extension. So this will be the therapist position, walk standing. You go underneath the knee, where your shoulder should be underneath the knee and your web space should be holding. The distraction should not come from the hand, it should come from your quads, where 10 degree of knee flexion is allowed on the opposite side, where you ask the patient to hold the plinth on the opposite side. This hand can be here, as it might restrict when we go further. Two outcomes you can see, one is pain, the other one is the range of motion. So you go underneath, go from the quads, ask the patient, educate the patient before doing the technique, where the patient should kick your shoulder, press your shoulder together. Two actions. Relax. I distract, relax, relax. Can you kick my shoulder? Press my shoulder together. Maximum. 5 seconds of isometric holds. 1, 2, 3, 4, 5. Relax. Maintain the distraction and see whether you are able to move further or not. If you have free range or if the patient is pain free, you move further. Ask the patient to again perform the same movement. Maintain the distraction. Maximum. 1, 2, 3, 4, 5. Relax. Maintain the distraction. Go further if you have access. Yes. Maximum contractions. 1, 2, 3, 4, 5. Relax. If the patient says pain, either you reduce the amount of range or take the limb into external rotation or abduction. That's all. Again pressure. Maximum. 1, 2, 3, 4, 5. Relax. Maintain the distraction. Come back. Relax. Come straight. Check the range. This is the maximum. I'm not pushing, I'm being very gentle. This is the maximum range. So this is for the hamstring. Can I take 2 more minutes? For the adductor? Yes, come on. Sorry? Yes. So general adductor length check. wider stance. I have a tape. I don't know whether I'll be able to assess or not. Yes. Maximum wide stance. Maximum. So this is maximum adductor length where I go from toe to toe, which is around 128 centimeter. Yes, right on there. CB. So this is two therapist technique. So the primary length is 128 now. You need two therapists to perform this technique where the patient is in lying. Again, distraction with active movement from the patient side. Where you see the adductor tension. So this is his range. Pull down. So this is in a maximal extended position. Again, ask the patient to lie down, relax. The lumbar should not arch. When you perform the movement, again with space, you should not take it further into flexion. It should be in a neutral angle where you distract, abduct further, and see the tension, and you will see. Two therapists together coordinate with the other therapist because there should be a similar tension which should be persisting. Stay relaxed. Distract, stay relaxed. Okay, and take it into abduction. Now we can feel the resistance here. Is it increasing? Communicate with the patient throughout the technique. Ask the patient to slowly sit down. Can you come up sitting? Yes. Can you put your hand in front? Little more in front. Can you do 10 push-ups? 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And slowly take your support. Maintain the distraction. Yes, you can lie down. It's not that easy to see the result in one repetition. So we are going for another one. Maintain the distraction. Take it further to abduction if you have range. Yes. Can you come up? Reach forward. Maintain the spine. Yes. Push up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Can you lie down now? Okay, time off. Yes, sir. Get done. Maintain the distraction. Begin. Can you come down? Can you make your side wider? Go maximum. So it is 149 and more. Thank you.